I just want to start by thanking my fellow presenters. I just thought that was fantastic and really interesting. I just want to acknowledge the intellectual leadership really and really significant contribution of New Zealand in their groundbreaking work on the investment model, and Damien's fascinating presentation, and shows you what you can do if you've got a unitary government. You can just boss everyone around, really. Second, though, really interesting work from the Commonwealth, and I thank Barry for his offer to make the Commonwealth data available to the states. I've brought a contract with me, and we can both sign it after the session. We'll have to make maybe a bit of a change, because when he said that cost recovery bit, I just thought the data was going to flow both literally and financially freely. But anyway, we're certainly going to talk about that later. But look, we're here to talk about the large data sets held by government, or big administrative data, and how we can use them to achieve better outcomes for people, because that's the key point of the data, and it's something that both speakers before me have emphasised, how we can use it to inform public policy and improve the lives of Australians and New Zealanders. So today I'm going to look, it's a bit personal for me, I'm going to look at one area of public policy I've been interested in for an awful long time, and how data can help policymakers understand the problems and the potential solutions. The area is child protection, which again the couple of presenters before me have thought a very good area for data analysis. And I'm going to look at three perspectives provided by the data, and crudely you can think of them as past, present and future. My story starts with the late, great John Patterson, and whose memory ANZSOG established the Patterson Oration, which was given last night by Anne Sherry, to recognise his quite distinctive contribution to public administration and public sector reform. One of John's great legacies was setting up the Child Protection Database when he was Director General of the Department of Health and Community Services. In the early 2000s, when I was at the Allen Consulting Group, I did a lot of work on child protection with the department, and this was before the database was available. So for the first report I did, we relied on what was the data that was around, which is point-in-time data. We reported how many children had been notified each year for concerns about child abuse, how many had been investigated for child abuse and substantiated for child abuse, how many each year were in out-of-home care. But Dr. Patterson's client administrative database, which he invested hugely in, it took a long time actually to come together, and through it you could track the clients over time, but also through the different child protection services. So he really drove and championed the importance of data to inform policy. So after a couple of years, the data had been cleaned up and trialled and was ready for analysis, and I was able to use it in my next report on child protection for the department. So it was really a revelation. The longitudinal data revealed a much more complex and challenging story than we'd presented in our first report. The longitudinal data showed that over a period of 5 years, most children notified for suspected child abuse had been notified before, 61%. Most children had been notified many times, 25% had been notified 4 times or more. And many children lived insecure and disrupted lives, cycling back and forth between their families and out-of-home care over 5 years, many of them in many different families, having many different foster carers, many different addresses, and attending many different schools. So this longitudinal data set, following these children for 5 years through the stages and cycle of the child protection system, really revealed their lives to us as policymakers. So it's definitely a story of bigger data and better understanding. Perhaps not big data as we now know it, but certainly bigger data than we had, and certainly more data. And over the years, the amount of administrative data available from child protection systems across Australia has been getting bigger and bigger. Each year, the Report on Government Services from the Productivity Commission publishes comparative data from the child protection systems across Australia. This year's report is about 350 pages long. But as we've said, the point of data is not just to describe the problems, the point is to help solve them. And sadly, over the same years as the reported administrative data from child protection systems has been getting bigger and bigger, outcomes for children have gotten worse. There's been an increase in substantiations for child abuse, an increase in child protection orders, an increase in children in out-of-home care, and an increase in multiple placements in care, which we know are extremely harmful for children. We have much better data pointing to and describing the problem, but where is the data that helps us as government know how to do something about it, how to solve the problem? This brings me to the second part of my talk, which is what is New South Wales doing? Now, in February this year, the New South Wales Government announced a social impact investment policy. Social impact investment takes aim at the fact that traditional approaches are not solving our most pressing social challenges. It brings together ideas, expertise and capital from public, private and not-for-profit sectors to try and achieve better targeted social outcomes. It has 4 elements. Prevention, it wants to shift money away from the high-cost tertiary or acute services to prevention. It focuses on outcomes, identifying, measuring, and it pays on outcomes. Innovation, it sets incentives and removes input controls for services. And its partnership approach, it shares the risks and the benefits across the government and non-government sectors. The social impact investment policy was informed by the New South Wales Government when it piloted 2 social benefit bonds. The most advanced of these pilots is what's called the new PIN social benefit bond of the United Care Burnside and Social Ventures Australia. Under this bond, United Care Burnside works intensively to either safely return children in out-of-home care to their families or prevent children from entering care in the first place. So they have the program, Social Ventures Australia, got the money together. They invested $7 million to expand the coverage of that program, and they targeted a return of 10 to 12% a year over 7 years. The investor returns are based on the proportion of children participating in the new PIN program that are restored to their families. It's been going for about 18 months, so it's still relatively new given it's a 7-year program. At the moment, it has a 62% restoration rate, which is very good, and about a 9% return for investors. So as part of that bond, the New South Wales Government has a payment by outcomes agreement with United Care and Social Ventures. So it effectively is sharing the financial benefits flowing from the social impact of the program. Given this, you can see that reliable data is essential to an effective social impact investment. It informs both the government and the service providers about what works and what the range of outcomes, positive or negative, that are or are not being achieved. Now, the pilots that we undertook, the government undertook to inform the investment approach, highlighted the importance not just of big data per se, but of having access to data sets that are useful and can be used, consistent and linkable, and of high quality. Now, some of the findings that came out of the pilots, and these points will be very familiar to you, but they found that the government data that was set up had been set up for purposes, of course, that were not considered when the processes were developed 5, 10, or even more years ago. The evaluation of the bonds highlighted that much of the data, government data, was designed for casework and administration and therefore was limited in its usefulness for measuring outcomes. So from a social impact investment perspective, we're seeking to build the evidence base of what works in social policy and the many domains where the benefits accrue. Traditionally, however, we haven't tracked or measured the full benefits from a program. This means that potentially we've been undervaluing the benefits derived from investments, which may result in poorly informed investment decisions. Following on from this, we know anecdotally that a program that improves parenting skills in most vulnerable families, which is like the program provided by United Care Burnside, will have benefits across government in the longer term. And this is the sort of work that Damien was talking to. It'll have better health, it'll have improved education, lower crime, lower drug and alcohol use. But agencies hold the data sets that are specific to their needs, and they have been developed within this silo approach. So this results in data that is captured inconsistently, difficult to combine or link with data from other agencies to be able to demonstrate the benefits of a program. So drawing on the experience of the pilots, the government's embarking on a series of social impact of benefits, one of which is focused on better outcomes for young people living out of home care and transitioning to independence. We know from previous research that young people living out of home care are much less likely to complete school, much more likely to have insecure accommodation, about 50% have experienced periods of homelessness, much more likely to have mental health problems, more likely to rely on government income support and be in marginal employment, and more likely to have their own children very early. A key component of this model of social investment is an agreed method for identifying, measuring and quantifying the outcomes and government costs from the investment. So learning from the New Zealand model of investment, we're undertaking to set these investments up in the beginning a data matching project involving a cohort of 5,000 young people aged 14 to 18 years who left out-of-home care in each year since 1996-97. From the analysis of this cohort data, the government's interested in understanding the different pathways of young people leaving out-of-home care and the associated costs, quantifying the lifetime costs to government of meeting the service needs of those who experience homelessness or require high levels of government support, and developing a data set that can be used to model the changes in social and financial outcomes when different service interventions are applied to improve transitions from out-of-home care, such as ways to prevent homelessness, reduce unemployment, increase educational attainment. The project's looking at data from government services across the New South Wales Government, from our Family and Community Services, Ministry of Health, Department of Education, Corrective Services. And we're also, here comes the pitch, looking to the Commonwealth to provide the income support data to improve the model. So this is where Barry comes in. And he very helpfully said he had lots of foster care data. You will have heard him say that. But actually, you can see the power of bringing the services and the income support together. So looking at this model and particularly learning from the New Zealand investment model, we're trying to think of three distinct differences or developments in the New South Wales work. We're tracking client services, not just the income support side, and their use and associated costs of the range of the services. And we hope this allows us to better understand how the services work together for people. For example, it could be that keeping someone housed or ensuring a young person completes tertiary education are linked to the effectiveness of drug and alcohol interventions. We're also going to assess the benefits to clients as well as the costs to government. Often there's a focus on the liability of clients to government, but social impact investment is about social and financial returns, and we want to start tracking social outcomes as well as see how those vary according to different client pathways. We hope by looking at the benefits and costs, we're able to make better investment decisions, very similar to what Damien was talking about. For example, that means, we might have a return that looks like a marginally higher investment, but that could lead to better outcomes than a minimise just liability approach. And we're applying the investment approach to the social impact transactions. The work is critical to putting together a robust financial model for a social impact transaction in the area of supporting vulnerable young people to transition to independence. That allows us to partner with the non-government sectors to rigorously test and learn whether services can change client trajectories in a way that shares the risks with the investors. I want to turn now to the third perspective on child protection and public policy that I think could be provided by the data, and this is my future perspective. Given its future, it's kind of a bit out there. I want to talk about predictive risk modelling, or sometimes called predictive analytics. Predictive analytics is the use of data, statistical algorithms and machine learning techniques to identify the likelihood of future outcomes based on historical data. The goal is to go beyond descriptive statistics and reporting on and understanding what has happened, like for example that we learned from the longitudinal databases. The predictive risk modelling aims to provide a best assessment of what will happen in the future. It tries to predict the future. It's an example, I think, of what Chris Anderson, who's the editor of the technology magazine Wired, meant when he said, with enough data, the numbers speak for themselves. Now that is a highly controversial statement, so don't just think that most people believe him, because they don't. But it's a very interesting statement when we're in the land of big data, big algorithms, big calculations. Do the numbers speak for themselves? Now, a very interesting research study, was undertaken in New Zealand, of course, to assess if predictive risk modelling tools that draw on linked administrative data could be used to identify newborn children at high risk of child abuse. The study developed a predictive risk model and applied it to a past cohort of children to see if it would have predicted a child coming into contact with child protection services. So the research study developed the predictive risk model, applied it to all children born in 2007, and the aim was to see if it could predict the risk of finding a substantiation of child abuse by the age of 2. So the predictive variables were drawn from birth data, demographics, government benefits data, child protection data, sentencing data, the sorts of things you'd think of. The main predictors of child abuse were found to be the presence of previous children in the family with contact with child protection services, the length of time the parent had been on income support or benefit over the past 5 years, and having a parent who had contact with child protection services in their own childhood. Now, the model performed reasonably well in predicting risk. So to illustrate, if we just looked at the 5% of children born in 2007 who had the highest risk scores on the predictive risk modelling. By age 5, in the absence of any intervention or any support services for vulnerable families, 57% of those children would have been notified at least once, and 31% would have had a substantiation of child abuse. Now, there are a lot of false positives to that. 43% would have not come into contact with child protection services. But that was a 5% risk you could target at a higher level of risk. Say at 1%, at the very highest level of risk, you were getting levels like 80% notified, 60% substantiated. But there is a very important caution to this. Risk is not the same as amenable to intervention and change. The efficacy and cost effectiveness of the predictive risk model as a screening tool is dependent on being coupled with early intervention services that you can offer to the families at birth that actually reduce the child abuse. Researchers in the United States have looked at using predictive risk modelling to identify a subset of child abuse cases, and these are cases where a child dies. They are asking the question, can predictive risk modelling predict at birth a child's likelihood of mortality at their parent's hand by age 5? This is an extremely challenging work and challenging concept. If the answer were to be yes, to a large degree of certainty, in the absence of effective preventative programs, which often we do not have, to be honest, of course, one of the most effective tools for preventing the deaths of children would be to remove them from their parent at birth. This is why I'm saying it's the future. Is it the future? We kind of have to look at what the power of some of these data sets and the tools can tell us, and then we have to think of, as government policy advisors, what do you do? And if you take it, as I say, you can sit there with something around, maybe 30, 40, 50% would be substantiated for child abuse, and you go, well, if you got an algorithm that a much higher level of certainty told you that child was likely to die at the hands of their parents, it's a fairly confronting thing to have to face. So, less confronting examples of predictive risk modelling in the area of child protection being researched in the United States are models of the probability that a child will be re-abused and the probability that reunification with a parent will be successful. So let me make some concluding comments. Wrestling with big administrative data sets is hard work, and I think both our speakers earlier who actually do the work, or certainly with Barry, has teams that work on it, they are messy, they're inconsistent, they're unconnected, and they often collect the wrong things. But they're ours. In government, this is the data that reflects, for better or for worse, the work we do. the clients we try to help. And they can help us do better. John Patterson's longitudinal client database changed the way we understood the complexities and challenges of child protection. It profoundly influenced policy response. In New South Wales, we're drawing on the hugely valuable insights of the New Zealand investment model and hoping to link the understanding we gain from a cohort analysis of young people leaving out-of-home care and their different pathways and service usage to inform a social impact investment to change these young people's trajectories, something that's defeated us for years. The predictive risk modelling offers the perhaps so far challenging, tantalising, but nevertheless the possibility that big administrative data will help us prevent child abuse occurring. I've looked today at one area of public policy, child protection, and at how I think data can help us as policymakers and in government understand the problems and the potential solutions. But there are many, many areas that are challenging for governments, and I, for one, particularly after hearing the previous two speakers, am encouraged and optimistic about the potential for harnessing those big data sets to help us. Thank you.